So one of the things I've been pointing out from the start with the COVID-19 is the lag you have between the statistics. People get the virus, SARS-CoV-2, and then it takes a couple of weeks for it to start doing the damage. And so the people you see die, when you see like this many got infected yesterday and then this many died, the ones that died were not a part of the ones who got infected. They got infected a couple of weeks earlier. And then if you want to talk about survivors, people who made it all the way through and developed immunity, that's more like 4 weeks. So these are going to lag behind each other. Something else I've talked about is the fact that we don't really have a good idea of how many people are actually infected, and that's what the CDC has been working on here in this story. Because if the people you're testing are the people you're worried about because they've got symptoms, then that's not going to give you a full picture. Of course, there's going to be a greater percentage of them, that die compared to the numbers the number of cases, as they say, but the actual number of infections is much larger, especially considering that most people who don't get it are asymptomatic. They have no reason to be tested, so they don't get counted. So that's what the CDC is trying to correct for here. And it actually looks like, and it's in this Jacob Sullum article in Reason, it's much less deadly than it looks, but it also makes it really difficult to do contact tracing. So, and I talked about Bruce Schneier in his column talking about how contact tracing is basically useless. That was a few weeks ago in the podcast. You can check that out. But he says, the ratio of estimated infections to known cases in these studies, which the U.S. Centers for Disease Control and Prevention, CDC, reported on Friday, ranged from 6-1 in Connecticut as of early May to 24-1 in Missouri as of late April. Now, what that means is, and those are different locations, we don't know how localized that is, but basically in May, when they said, okay, we have these many people infected, well, 6 times as many actually were infected than were measured. And in Missouri in late April, it was 24 times as many. So the actual number of infections is 24 times as great as the number of cases, and the fatality rate is going to end up being that much smaller as a result. Because when you look at the fatality rate, that needs to be made of the whole number of infections, not just of the ones you found. So it says these results confirm something we already knew. The COVID-19 infection fatality rate, deaths as a share of all infections, is much lower than the crude case fatality rate, deaths as a share of known cases. The CDC's antibody studies imply that efforts to control the epidemic through testing, isolation, quarantine, and contact tracing will not be very effective, since they reach only a small percentage of virus carriers. The CDC analyzed blood samples drawn from routine tests unrelated to COVID-19 from patients in New York City, Connecticut, South Florida, Missouri, Utah, and Western Washington state. Although these samples may not be representative of the general population, they provide a clearer picture of virus prevalence than screening limited to people who sought virus tests because they had symptoms consistent with COVID-19 or because they were in close contact with known carriers. In New York City, where the samples were drawn from March 23rd through April 1st, nearly 7% tested positive for COVID-19 antibodies, implying that infections outnumbered reported cases during that period by 12-1. And then in a state-sponsored antibody study, it was about 11-1, so about the same. The difference in estimated prevalence can be at least partly explained by the spread of the virus between early and late April. And it'll be interesting to see what happens. You're probably seeing this. I'm not sure when it'll be scheduled, but it'll probably be a couple of weeks after I made it. It's July 1st right now as I record this. I'm just doing a whole bunch of these to keep videos coming over my vacation. So when I get back, we might look at updated stats and see what it's like. So you might be going, hey, that's way out of date. We know different now. Well, maybe you will. This is as of July 1st. So. But it says the CDC study was based on patients whose doctors ordered routine blood tests, while the New York State Department of Health study used blood drawn from randomly selected shoppers. infections might have been unusually common among people who ventured out to stores during the study period, either because they were more likely to encounter carriers or because they had already recovered from COVID-19 and therefore felt safe leaving their home. But then again, they might have missed people who had symptoms or didn't venture out because they were in close contact with people who had COVID-19 or who were a risk for it. So, really difficult to get the accurate numbers here. The CDC put the ratio of infections to confirmed cases in South Florida at 11-1, which we just saw, and the same in Utah and Western Washington. In Connecticut, where blood was drawn from April 26th through May 3rd, they had the lowest ratio, 6-1. In Missouri, it was the highest, 24-1. So no matter how you slice it, it's a lot more. It says there is a striking gap between the crude case fatality rates in New York City and Connecticut, 8.4 and 9.3%, and the crude CFRs in Utah and Missouri, 0.8% and 4.9%. That suggests that COVID-19 patients have fared worse in New York City and Connecticut than they have in Utah and Missouri, for reasons which may include the prevalence of pre-existing medical conditions, the stress that the epidemic put on local healthcare systems, and policies regarding high-risk people such as nursing home residents. Yeah, that was a bad move, wasn't it, Cuomo? Do you feel stupid for doing that? People were telling you at the time it was dumb. Oh no, we have to make nursing homes take COVID-19 patients. Are you serious? My God, what were you on that day? Based on the CDC's best estimates of the death rate among all Americans who develop COVID-19 symptoms, whether or not they are tested for the virus, and the percentage of infections that are asymptomatic, the nationwide IFR is something like 0.26%. In other words, if you're like the average person, who doesn't exist, we all know that, but if you're like the average person and you get SARS-CoV-2, you get infected with the virus, you have a 0.26% chance of actually dying from it. So that doesn't really sound like it's should be sounding the alarm bells, should it? You know, especially when we know who the high risk population is, and we can keep them, keep people away from them. But again, as long as you're a young person in your 20s, you're low risk, and you don't live or work around anyone who's high risk, I say, just go for it, do your thing. Because you're going to come through it with an immunity. And we don't really know how long the immunity lasts because it hasn't been around that long. But we do know, and I covered this on the podcast as well, the information that was out there saying that people lose their immunity was based on faulty testing. So the only way you really know that is by doing a blood test and growing the cultures. And every time they've done that I've seen, it's meant that the people have kept their immunity, for weeks, months, however long it's been. When the ratio of infections to confirmed cases is high, there is little hope of containing transmission by identifying and quarantining carriers and their contacts, even if a state has the capacity to do contact tracing. So, it's just the fact that most people, who have COVID-19 never know they have it. You don't know that's the person they're supposed to be tracing. How's that going to work? Plus all the stuff Bruce Schneier talked about. I might stick that Schneier link in the show notes as well, just to remind you of it. But newly infected people in states such as Texas, Florida, Arizona, and California are substantially younger now than they were earlier in the epidemic, which means the death rate in those places should be falling. Because again, it's being spread among the healthier population. And if we can get that population up to a 60% immunity, or 65, whatever it is, that's herd immunity. And as long as they're just average people, spread throughout the population, that should protect everyone else without having to wait for a vaccine. That doesn't seem insurmountable, especially considering how low the death rate really is. Since neither contact tracing nor a vaccine is likely to save high-risk Texans, the ultimate death toll will depend largely on precautions aimed at protecting them. Governor Greg Abbott has responded to the new wave of infections, which he says is driven largely by people who have been getting together for drinks in close proximity, by closing bars. But if young Texans are increasingly disinclined to follow social distancing rules, that step may not accomplish much. They can still get together in private, and their risk of exposure will in any case be higher as they return to work. Nor can those people whose own risk of dying from COVID-19 is very low necessarily be counted on to avoid contact with Texans who are much more vulnerable to the disease. I mean, that's the catch right there. We want it among the healthy population to get an immunity, but we want the healthy population separated from the at-risk. Pretty much when this all started, my sister basically sequestered our mother. You know, she's healthy, but she's in her 80s, and I've seen her a few times, and of course, but I mean, I've had just minimal contact, just trying to make sure, trying to keep her safe, and that's the thing you need to think about. And he says, the onus for preventing contact between potential carriers and high-risk individuals seems to be shifting, fairly or not, from the first group to the second. Minimizing COVID-19 deaths will require adapting to that reality. Right, you don't want to be isolating people from their jobs or the bars or everything. You want to be isolating them from people who are at high risk. And I mean, in every other pandemic, they've known this. You take the people who are sick, you take the people who are at risk, and, you quarantine them, you isolate them, you try to keep them from getting it, This is the first time I think they've said, oh, we need everybody to, it's just ridiculous. Absolutely ridiculous. We need to get the economy going again. We need to get the healthy population interacting with each other so we can build up a natural immunity, because it's still going to be a while before there's a vaccine. Believe me, I'd love there to be a vaccine right now and say, okay, let's just all get vaccinated. I'm a huge fan of vaccines, but not going to be an option for a while. We just need to be a lot more sensible about how we're doing this. And here's the CDC themselves saying exactly that. All of this is a logical consequence of the CDC's report. Even if they're not calling for that directly, that's what their stats say. This is what drives me crazy about the CDC. We see this over and over again. The statistics say one thing, but their policy is another. Go look at my channel and what I've said about the so-called opioid epidemic, and look at the CDC figures, and I've given sources to all of those, but then look at what they say. Oh, there's this horrible epidemic, when there isn't. There's a problem with illicit fentanyl on the black market, which is just extremely toxic and is killing people right and left. That's what's driving the increase, not doctors prescribing opioids to the patients. So, and we saw the same thing with guns, didn't we? Way back in the 90s, they did that big study trying to figure out how many people use guns defensively. They got a figure of like a couple million a year, similar to what Gary Kleck got when he did his study. And of course, all of the gun control nut bars are like, oh, no, that's a fraud study. Look at what the government did. Well, the government covered up what they did. And like 10 years ago, where it was, the CDC did this big report on, all of the available data where, they looked at all of the defensive gun studies except their own, which was still buried. And then a few years ago, a researcher dug that up and was like, wait a minute, look at this. They did all of this in the 90s. They stopped it. They know the guns are used for defense far, far more often than they're used offensively. But look at their policy recommendations. The CDC should not be a political organization. They should be, in my opinion, prohibited from any kind of policy recommendations and just report on the statistics and whatever scientific conclusions and consensus might be drawn from them. So they're really good about that, but then they'll turn around and do the exact opposite when it comes to setting policy. That needs to change. So thank you very much for watching. As always, hit like, subscribe, and the bell, and share this video everywhere to help ease the problems this channel has suffered from the shadow banning, whatever's going on with that. Believe me, if I knew what was going on in the background to try to fix it, I would, but, try getting information from YouTube as of that. But, when you're searching directly for titles of my videos and you're not getting them, that's a problem. So So share this video around to anyone you think might like to see it. And if you'd like to donate, please do so. Donate.bogosity.tv. You can just use cryptocurrency and just give a few pennies if you want. I don't mind. They add up. You know, if a bunch of people do that, don't go thinking, oh, well, I'd like to give, but I can't afford to give much. You give what you can. On the other hand, I understand if money's tight right now, we're all going through a lot. So if nothing else, just share the videos and keep watching. Thank you so much for watching this one. And until next time, stay strong and be free.